hello to the viewers. Today we are at Miracle Advanced Reproductive Centre, Kilpauk, and we are going to meet Dr. M.D. Kini, the Clinical Director, Miracle. He has worked for 37 years in infertility treatments alongside late Professor Edwards, Cambridge University, UK, who had received the Nobel Prize for Medicine in 2010. And now let's meet Dr. Kini and discuss about infertility issues. Hello, doctor. What's your opinion about infertility? Because when I spoke to one of your doctors about polycystic ovaries a couple of hours ago, do you want to add something over it?
Hello, I want to talk to you about polycystic ovaries and the complications of treating polycystic ovarian disease and what complications we can get in patients. One of the serious complications we can get with treating polycystic ovaries is that we sometimes get large number of eggs. We have collected in one patient something like 98 eggs in one treatment cycle. These patients are at higher risk of getting what we call ovarian hyperstimulation syndrome. So whenever we get a few follicles, that is less than say about 5 to 6 follicles on each ovary, the ovaries are not very large. They are slightly bigger than about 3 centimeters in diameter, but when we get such large number of eggs, the ovaries do get 5, 6, 7, 8 or even 10 centimeters in diameter. When the ovaries are large, then they become very painful. Apart from pain, these ovaries do produce some amount of fluid which accumulates in the stomach, and this fluid is normally drawn from the blood. So the blood gets slightly concentrated and it loses lots of electrolytes into the fluid. So there is disturbance of electrolytes in the blood, and that affects the kidney function. So if we do not take any notice of what's happening in the body at that stage, the kidney function deteriorates, you get kidney failure, and the patients die. So this is a very, very serious complication of treating fertility patients. So we have to identify these patients. We have to see whether we can avoid hyperstimulation. And there are several steps we take. One is to make sure that we do not give excessive stimulation for these patients. The second step we take is make sure that the patients take large amount of fluid in their diet. Third step we take is identify again how the ovaries are producing the follicles, and if we think large number of follicles are being produced, then we may go and collect the eggs when the follicles are very, very small. They are about 3 to 5 millimeters in diameter. At this stage, if we go and collect the eggs, they are very immature, and these eggs have got to be matured in the laboratory. And there are very few centers around the world, including in India, very few centers which do that type of treatment. And we are one among them who do the treatment, and we have been doing it for several years. And these eggs are matured in the lab, and then they are injected with the sperm, fertilized, and those embryos are put back. So what we do is, in such patients, we do not put the embryos back in the same cycle. We go into a subsequent cycle where we have not given any stimulation, so there is no risk of ovarian hyperstimulation. So that's the next step we take. Now, in going back in the 80s and 90s, we were getting about 8 to 10 patients with ovarian hyperstimulation every year when we were treating about 250, 300 cycles a year. Now, these days, in the last 15 years, our center had no ovarian hyperstimulation syndrome patients, complications. So that is something remarkable. And also, by freezing embryos and putting them back in the subsequent cycles has again improved quite a lot because of these freezing techniques and also the culture media. So we are now avoiding ovarian hyperstimulation completely.
Doctor, do you have any egg donors in your center apart from the sperm donors?
Yes, you have asked me something very important because we have got a egg bank in this center. We have been running it for last 7-8 years, and we can have readily available eggs. But something unique we do in Miracle is that when we get egg donors, we screen them for all the possible infections they can get and make sure they are perfectly healthy to donate eggs. And once they have donated the eggs, these eggs are always frozen. We never give fresh eggs for anybody who needs eggs. These frozen eggs are kept quarantined for at least 6 months. The egg donor will come back in 6 months' time and do all the screening tests again. And if those screening tests are okay, then those eggs that were donated earlier could be used for patient treatment. This is never done in any center, as far as I know, either in India or even in Europe. Only certain centers in United States do that by quarantining the eggs. This is very important because when sperm donors give sperm, we always quarantine the specimen for 6 months. Do 2 screening tests, one initially and one after 6 months, and if those are clear, then we use the sperm donation. It should be done the same because the gametes are same. The risk is same. So why not do it for even eggs? So we started that about 8 years ago, and we are religiously doing that so that we can give very safe eggs. And one of the advantages of having a sperm bank is we can preserve the fertility, whether they are going for treatment with the cytotoxic drugs for malignancy, or whether they just want to postpone having a baby because it's not convenient to have it at this stage. So we can freeze the eggs and keep them for any length of time. So we have got a sperm bank as well as an egg bank, and these frozen eggs could be used at most convenient time.
Doctor, what makes Miracle unique from other clinics across the globe?
Shiva, thank you very much for asking me that. Miracle is a unique clinic, not just in Chennai, not just in India, but throughout the whole world. One is that we see all our patients by appointment. If it's an emergency, we see them anytime. So none of our patients wait more than 15 minutes to be seen by doctor, nurse, or having a procedure done. That's for something unique. Second thing that we do is we bring advanced technology from the West right up to India. So you do not have to go to a Western country to have your treatment done. Like we do in vitro fertilization treatment cycles, in vitro maturation of the oocytes, sperm and egg freezing, egg bank, cytoplasmic transfer, which we have already talked about. These are all the advanced technology. We can do it here in India. So Miracle is a unique clinic. It's an advanced technology clinic. The advanced technology is come to India. You don't have to go abroad to get it.
Thank you very much for the advices, Doctor. Doctor, finally to wrap up, what is your suggestion that you could give for the present generations?
Thank you. I think the suggestions I give you, to the present generation is, one is have healthy living. Smoking, alcohol intake, junk food, things like this you have to avoid and have a healthy living, healthy diet, exercise, and maintain yourself in prime condition. That's the first thing you have to do. Second thing is, do not immediately jump for a treatment cycle. You always wait for some time to see whether a natural pregnancy can occur. If it hasn't occurred within a reasonable time depending upon the age of the wife, then you seek advice. It doesn't mean if you come to the infertility center, you will always have a treatment. If it is not the right time to do the treatment, we normally tell you to wait for some time and then come back later after 6 months or a year or after 2 years. So that's very important. It doesn't mean if you walk into a fertility clinic, you're always going to have a treatment. It's either IVF or intrauterine insemination. So don't hesitate to come and seek advice.
Thank you for watching this show with Dr. Kini, one of the renowned and the most experienced doctor in the nation. Thank you, doctor. Thank you very much.
Thank you, Hello City team. Thank you for coming to Miracle and having this video clip done for us. We are very grateful. Now, my only plea is anyone who has got any fertility problems, do not hesitate to contact us, either by phone, email, or even come and see us, because you should be quite comfortable to come and see the doctors and discuss your problems. Thank you.